Health Benefits Associates, your Nevada Medicare experts. Call them today. Dr. Pinkston.
Hi, good to see you.
So doctor, nice place. What is this?
This is Pinnacle Medical Group, and this is one of our 4 locations where we see our patients.
And this is the one on Charlins Avenue.
Correct.
Besides people coming for like a yearly medical visit, what can you do here?
Well, this is a primary care office, so we provide comprehensive care, and that includes not only annual visits, but also visits for urgent issues and visits where we take care of chronic health conditions.
Doctor, I want to ask you about heart issues. Are you able to detect a lot of heart issues that people may have here at this office?
Certainly, we can absolutely perform some initial heart testing, including EKGs, and we also offer cardiac echoes as well. And so if any of that's abnormal, or if the patient's having any concerning symptoms, we can get them in with a cardiologist.
What is the most frequent heart issue that you see here in this office?
I would say heart issues related to high blood pressure, so congestive heart failure or sometimes heart attack.
What if they need like further examination of this heart issue? What do you do?
Refer to cardiology.
Cardiology. Do you have people in mind that you refer these people to?
Well, I like referring people to Dr. Desai for cardiology, as well as Northern Nevada.
Tell us about Dr. Desai.
Well, Dr. Desai's been a cardiologist here in Reno for a while now, and he's taken care of quite a few of my patients, and my patients like him a lot.
How do you think we are in terms of cardiology care in Northern Nevada?
I think we have good cardiology care here in Northern Nevada. I think access is always a little bit of an issue, so anytime I need to get a heart patient in for an issue pretty quickly, Dr. Desai is one of those people I can get them in with.
What kind of time frame are we looking at here? If you refer somebody to a cardiologist, how soon can that cardiologist see these people?
Well, sometimes it's an urgent issue and I need them to be seen within the week, and sometimes it's more non-urgent and they can wait a couple months to be seen.
You do good work here. Do you like it?
I do like it. I do have a fair number of patients with heart problems, and there's definitely some easy lifestyle steps that people can take to help improve their heart health. Most of those include diet, exercise, and not smoking. One thing a lot of people don't know about nutrition that I frequently look into in primary care is vitamin D levels. Almost everybody's deficient in vitamin D unless they're outside all the time in the sun. And so because that's such an important vitamin for calcium absorption, bone health, muscle health, I usually check levels for patients and get them on a supplement if needed. Yeah, so I think we hear a lot about fad diets right now, and generally speaking, if you're eliminating an entire food group from your diet, that's typically not sustainable over time. I think it's important to eat everything in moderation, and I would say one of the healthiest diets you can follow would be the Mediterranean diet. And that's because it focuses on fresh fruits, fresh vegetables. It's low in, red meats, saturated fats, and high in whole grains and healthy fats. I would say my favorite piece of advice for healthy living is start small. A lot of patients think that they need to do a complete overhaul of their entire diet, their entire exercise regimen, but really, if you can just start by adding an apple and a vegetable per day and a 10-minute walk, that's going to do wonders for you. I love working at Pinnacle Medical Group because I have the flexibility to individualize patient care. I also just really like my colleagues and the people that I work with. I think we have a really dedicated team of primary care providers that are all really excellent at what they do, and we also have very dedicated staff, including our medical assistants and front desk staff who care about making the patient experience a good one. I think it can be a little overwhelming sometimes to go to your doctor, especially if you have a lot on your mind. And so I think sometimes coming up with a list of things and bringing that to your doctor's appointment can help prepare you. In my opinion, the most important questions a patient should ask are, what preventative care should I do? Like, what cancer screenings should I do? What preventative labs should I do? What vaccinations I should do to help prevent disease as opposed to treat it once it already happens. I do have a lot of patients in Medicare. I would say, there's a big aging population in northern Nevada, so that just naturally is a big part of primary care. I have a pretty large amount of seniors in my patient panel, and so it's important that we work with those patients to provide good care.